Hey, Florida. Great to see everybody. Awesome to be here. Let me find my clicker. Here it is. I got it. Wonderful to be here. Incredible day that I've had a chance to spend with you in some of the breakout sessions, and really look forward to talking to you today about what we're not only have done in the past in the American Cancer Society, but the commitment that we have to the future. And it really is based on a foundation of Relay for Life. It is about building healthy communities. The history of Relay is about celebrating. It's about remembering those that we've lost, and it's about giving everyone a chance to fight back. It is about energizing a community. And some of you, everyone knows about our founder, Gordy Klatt. But perhaps not all of you know how that first relay was conducted. In that first relay, Gordy was on the track the whole 24 hours. And he ran and he walked for a full 24 hours. And the way the money was raised is you paid money to walk or run with him for 30 minutes. Anybody know how many miles Gordy Klatt covered in that first relay? As if this group would not know. And by the way, the first row just like hit it out of the park. 83 miles that he covered in that first relay. The first relay was hard work. It was striving. It was reaching. And that's really what we have to do in cancer control, inspired by Gordy. You know, in 1985, when Gordy walked in Tacoma, Washington, to create the event today, Build Around Survivors, many of you may not remember or be old enough to remember that in 1985, the word survivorship and survivors truly had not become part of the lexicon. Cancer survivors felt isolated, they felt alone, and the diagnosis of cancer, even then, still carried a stigma with it. And I'm telling you, ladies and gentlemen, no event in the United States, no event has done as much to change that picture of what it means to be a survivor than the American Cancer Society Relay for Life. Relay for Life is what took the stigma away from cancer, and it brought survivors out to celebrate, to shout out, to insist that we make a difference in this disease. And today, look what we've done in cancer survivorship. Just a few months ago, we hired our first ever vice president for cancer survivorship, Dr. Catherine Alfano, coming to us from NIH because she really wanted to see if she could put that research into action. Dr. Kevin Stein, Dr. Corinne Leach, who have, together with their teams, conducted among the largest studies of cancer survivors and quality of life that's ever been performed. This is just a small group of the research articles that we have published out of our Behavioral Research Center, and we have a commitment now to truly further the science of what it means to live a high quality of life. With the help of a 5-year CDC grant, we were able to create the National Cancer Survivorship Resource Center, tools for cancer survivors and caregivers, for healthcare professionals, for the policy and advocacy community. And one of the things I am most excited about, just a few months ago, we published the first ever guideline for prostate cancer survivorship aimed to primary care clinicians. So when people ask, what do we do that affects folks locally? We are setting the standards, guiding and educating every clinician in America and every oncologist and primary care clinician about what the standard of care is to provide high-quality survivorship care. Now, how did we build 14 million, allow 14 million cancer survivors to be allowed today, and that's going to grow to 18 million. I always say when I hear that number, it's both good news and bad news. If people develop cancer, we want them to be survivors. But we have the opportunity to help fewer people develop cancer, so we need to do both things at the same time. But of course, we've allowed people to live longer because your American Cancer Society has invested $4.3 billion on cancer research, funded over 30,000 grants, and as you know, more than any other private nonprofit funder. You all know that we funded 47 Nobel laureates, far more than any non-government funder has ever imagined, any university has ever employed, 47 Nobel laureates. And just in case you think we've lost our touch at picking the best and the brightest research, 11 of the names that you see in front of you received their Nobel Prize within the last 10 years, including 2 of them just in 2013. We pick the best and the brightest, and we continue to do that every day. When we talk about cancer survivors, just look at the data. It says everything you need to know. Every major type of adult cancer is in front of you, and 5-year survival has grown from the 70s to where we are today for every single one of those cancer types. So if you want to know why there are 14 million today, and there are going to be 18 million in just a few years, it's because people are living longer and they're enjoying and living truly rich lives together. It is ultimately Relay for Life that gave that voice to cancer survivorship, that took the stigma away. But we've done that with our brothers and our sisters and our parents and our mothers and fathers and grandparents. We've done that with our friends. We've walked together. We've celebrated together. At times we have cried together, and we have felt pain together. But we have done it as a community, and that is what it's going to take. Activating communities to really see an end to cancer as a major public health problem in this country. And I'll tell you, gang, it's going to take all hands on deck. We talk about the American Cancer Society being the leader in the cancer fight, but please don't misunderstand what that means. We need every cancer organization. We need the government. We need the small. We need the large. What we can do as the American Cancer Society that no one else can do is we can bring them together as one. Build the best research, build the service programs. We cannot do it alone, but we can do it as a village, as a community, and we will. I pledge that to you. And you know that while so many other organizations are doing amazing things, and we celebrate their contribution and thank them for it, our Road to Recovery program still, by far, the largest single means of transportation for cancer patients in the nation. In its history now, we've provided close to 6.5 million rides for cancer treatment. And as Ralph said, we are committed to making that program stronger and better and more efficient. You know, I looked at this number and getting ready for my talk in Florida, I said, you know, this year, ladies and gentlemen, Hope Lodge will pass up the $500 million of hotel bills prevented. We will pass up the $500 million mark just this year. And as you know, 31 Hope Lodges, but 31 and counting. We have 7 more in the works just in this country alone. And I'll tell you about our plans around the country. But it's an incredible program. I know many of you have been there, have touched it, and have seen it. But nothing perhaps excites me more. As wonderful it is to have 31 Hope Lodges, we know that is not enough to meet the lodging needs of our nation's cancer patients. Our fastest growing patient service program in the American Cancer Society is our partnership with our national hotel sponsor, Extended Stay America, now having served over 7,000 patients, well over 40,000 nights of lodging. And as I say, zooming off the charts, we're getting incredible demand. If, just in case, you did not see the Today Show program just a few days ago about this program and about Hope Lodge, perhaps you did not get a chance to celebrate what I'm about to show you, and it will be news. The Extended Stay headquarters is in Charlotte, North Carolina. They're not in Florida. But I was hoping that maybe your thank you to them could reach Charlotte, North Carolina, because they have made the pledge to donate 100,000 nights over the next 2 years to our cancer patients. It's an amazing program. We have a lot of local hotels that are helping out too. Our health insurance assistance service, all of these programs are great, but let me tell you folks, if you do not have health insurance, there's no starting point. The roads don't matter, the lodging doesn't matter. You need to be able to pay for care. And it was a decade ago that the American Cancer Society published the research showing that uninsurance leads to cancer death that could be avoided. And we built the first ever health insurance assistance service, which back then, remarkably, able to help 1 in 5. But isn't it wonderful today to be able to recognize that we now help 2 out of every 3 callers who calls our health insurance assistance service. Brian, 50 years old, developed prostate cancer, recently laid off from his job. He was living on a monthly income of $1,800 a month. And he said, well, you can get insurance. You can get insurance through the COBRA program to get your prostate cancer treated, except for one tiny detail. It was 1/3 of his total income, $600 a month. And he called the Health Insurance Assistance Service, who helped them find a silver plan, $71 a month. And I am happy to tell you that Brian is now accessing, right now, the treatment that he needs for prostate cancer. We need to tell the story, folks, and I know we will. I know we're going to tell it in Florida and around the country. And all of you know about the incredible NCIC. I was just in Austin, Texas 2 days ago. If you ever get a chance to, you're just passing through Austin, Texas, good time to go right now, 110 degrees. It's air conditioned, right, Joe? It's air conditioned in the facility, so we'll welcome you in. And I'm serious, every one of you is welcome. They love, you just have to see it and experience to realize what it's like to have 512 people in Austin taking calls from caregivers, from cancer patients, connecting people with services, providing the health insurance assistance service, doing the clinical services matching, providing the connection for volunteers who are looking for a relay they can participate, all happening 24/7, 365, as it has now for many years at the NCIC in Austin, Texas. 16.8 million calls, 500,000 emails, 100,000 chats, and still counting in our extraordinary history at NCIC. And believe me, folks, we're going to make it bigger and better. The most visited website in the cancer space, cancer.org, 61 million visitors per year. 61 million visitors. So do the math. Are you all doing the math? For those who could not do it quite fast enough, I know most of you had already had that number. That's 116 visitors to cancer.org every minute, every year. Incredible the information we're able to provide. So think what Relay has done in this country. It's incredible. So much of this would never have been imagined if we had not shone the light on the problems of cancer in the United States and given a voice to cancer survivors. But look what's happening around the world that we are a part of. 14.1 million new cases in 2012, and that will grow to 21.7 new cases in 2030. And the destigmatization of cancer that we have brought about, and frankly today we take for granted, right? We speak proudly about the fight we're engaged in, about being a cancer survivors, but around the world, cancer is the way we were 35 years ago. It's still stigmatized. And that's why we have taken Hope, Relay for Life, on the road to now in 22 different countries, including many low-income countries. We will take that hope, message of hope around the world, and we're doing it through Global Relay right now. But we're going to take what we've done with Global Relay, ladies and gentlemen, and I believe that in the next 5 years, we will expand our influence even greater. Tanzania is the size of Texas, Louisiana, and Mississippi combined. The country experiences 5,000 new cancer cases, and in that giant country, cancer treatment is available in exactly one city, the capital of Tanzania. Many people are unable to travel to the capital at all. Of those who are able to get there, 500 patients every year have no place to stay. They literally sleep on the street, under bridges, waiting for cancer treatment. So I think it's time that we spread Hope Lodge around the globe. And we have made that commitment in 3 countries working in Africa right now. And if you're looking for the odds in Vegas, I know many of you are looking to put a bet down on this, Kenya will be #1. I think we'll see our first Hope Lodge in Kenya. We're making real advances there. We're going to get it done. This is the face today of cancer in Africa, where we do most of our global work. Not only is there often no treatment for the cancer, But believe it or not, there is no treatment for the pain, no treatment for suffering. So in Uganda, when we signed an agreement with the foreign ministry to start producing oral morphine in that country, they had been without any oral morphine, not a single dose, for 2 years, from 2010 to 2012. They now have oral morphine through our American Cancer Society Treat the Pain program. And just yesterday, I was on the call with Dr. Meg O'Brien, who leads this program, and we are about to embark on our first partnership to make cancer drug treatment available for acute lymphocytic leukemia and lymphoma in Africa, working with several other partners. So this will no longer be the face of Africa around the world. We are going to make a difference there. No longer the face of cancer. And in fact, we have done this in this country. We're not just about saving lives, we are also about preventing suffering. Once again, amazing work at both ACS-CAN and the Cancer Action Network. The National Palliative Care Research Center, $23 million in research that we funded, 8 research retreats we've supported, and we've awarded 6 Pathfinder in Palliative Care awards through ours. And this is the campaign I'm showing you from the ACS Cancer Action Network, who introduced the Palliative Care and Hospice Education and Training Act. Many of you may not realize it is now the standard of care that palliative care, the relief of symptoms, the relief of pain, and all suffering must be initiated right when the cancer diagnosis occurs. And we are committed to making sure that every patient not only gets their cancer treated, but has their symptoms addressed as well, starting from day one and moving forward through the Cancer Action Network and through the work we're doing at ACS-CAN. One of the most exciting things that came out of our reorganization is we have 600 staff members in divisions around the country, including, of course, right here in Florida, who are working with hospital systems, state health systems, and primary care health systems to spread the word that there's a new expectation about palliative care and symptom relief. It starts with diagnosis, and it continues on all the way to cure or all the way to end of life, whichever we reach. And we will make that happen. And I'm so excited. I hope some of you know this person, Dr. Christina Austin Valier. Good. I was hoping. We became the first group in the nation to recognize the contribution of caregivers, professional caregivers who relieve symptoms. And Dr. Valier, just this year in 2015, was one of our National Lane Adams Award winners for her tremendous contribution to relieving suffering, relieving pain, and caring for cancer patients right here in Florida. We became the first organization to award a Medal of Honor, an award of that stature, to the mother of palliative care in the United States, Dr. Kathleen Foley, who has said what a difference the American Cancer Society has made in pain and suffering for cancer patients. So Relay for Life is all about bringing together communities to end cancer as a major public health problem here and around the world. And this issue of community is central to what I hope to communicate today, because where you live matters. You all know about the genetics of cancer, but do you know about the geography of cancer? And we have a phrase that guides our cancer control work: your zip code is more important than your genetic code. 14 years difference in life expectancy, all based on where you were born, your income, your education level, the habits that you develop in youth. The true determinants of health come from where we live, work, eat, play, and pray. They either build the foundation of good health or they contribute to the poor health and, frankly, to the risk of cancer. We need to create communities that are free of tobacco. Did you know, ladies and gentlemen, that due to the work of the American Cancer Society Action Network, ACS, and all of our partners, youth smoking rates are now at the lowest point that they have ever been recorded. And you guys are in the top 10. Got a long way to go. We got a long way to go, but we're going to do it. We're going to do it one community at a time, one state at a time, and the nation, one nation at a time. We are going to make it happen. We need to make sure that everyone has an equal opportunity to find a grocery store in their neighborhood, to have access to healthy foods, to have an opportunity to exercise, to make sure that education is available for our youth, because let's face it, your risk of future cancer to a substantial extent is determined by the time you hit 21, whether you smoke or not, what you eat, how you exercise, whether you have high educational achievement. We can help create healthier communities here and around the world. I believe we need to bring the relay back to relay. I keep thinking of Gordy Klatt, 83 miles around the track. We need this to be about creating a healthier place to live. I love this picture. Relay for life. Look at that incredible spread, the healthy foods. And then I had a pretty depressing thought. It's photoshopped. I don't think that was the food that was really there. But I will tell you, all you cancer survivors and caregivers, how many of you developed cancer and said, you know what? I'm going to live a healthy life. I'm going to eat healthy foods. I'm going to exercise every day. Let's walk the walk at Relay. I have a vision where healthy food choices are available at every Relay for Life. Let's start it right here in Florida. We can help our communities be 80% by 18 communities. The nation has become energized by the goal of achieving 80% colon cancer screening rates by the end of 2018. This is our 80 by 18 campaign. And how do we get it done? You know how we get it done. We get it done one community at a time. And why are we doing it? Well, very simple. We just published this research. If we can achieve 80% by 2018, and we're at 65% right now, we're at 80% right now in college graduates. We just need to do it for everybody. If we achieve it, 277,000 cases of colon cancer will never occur. 203,000 deaths will be completely prevented by 2030, and many more to go. Colon cancer would no longer be the second leading cause of cancer-related death in the United States. It would probably fall to fifth or sixth. We can get it done. We're going to do it one community at a time. Let's create 80% communities, one relay at a time. We are, in fact, focused on doing whatever it takes to eliminate cancer as a major public health problem. And we're doing that every day in the American Cancer Society. Over $20 million every year dedicated to tobacco control and advocacy. Over $35 million through our change grants and other programs every year to increase screening for breast, cervical, colon, prostate, and now lung cancer. We now have a screening test, and here is our American Cancer Society lung cancer screening guideline that can help reduce the death rate for the #1 cause of cancer-related death in the United States. That's lung cancer, where many people had no hope at all. People with long smoking histories, and lung cancer was never the fault of the smokers, ladies and gentlemen. It was always the fault of the tobacco industry that produced an addictive product where people got hooked on during their adolescent years and youth. So we now have something to offer those heavy smokers who were the victims of the tobacco industry. We can substantially reduce their risk of dying of lung cancer. And I'm thrilled to report we just were awarded a $1.2 million grant to promote lung cancer screening in poor neighborhoods from the Bristol Myers Squibb Foundation, and we're going to be starting that work very, very soon. We have a new test. We can make a real impact on lung cancer. And we're going to have a new national focus, in fact, a global focus, because the human papillomavirus is the second contributes to cancers in men and women around the world. And in fact, in women, HPV-related cancers are the second leading cause of cancer-related death, and in many countries, the leading cause. Our HPV vaccination rate in this country is 34%. We can get this to 80%, and we have become the leaders in this fight because over the past year and a half, we have been able to attract $7 million from CDC funding to help increase our vaccination rate from 34 to 84%. Now, you may say 80%, that's a big number, but I just want you to know that in Rwanda, in Africa, their HPV vaccination rate is 98%. If they can do it in Rwanda, let's get it done in the United States. I believe we will reach 80% HPV vaccination rates, and I guarantee you this, we're right at the heart of it. The HPV Vaccination Roundtable is now established and working through your American Cancer Society. Look at the deaths we've averted, over 1 million deaths that we have helped prevent in men, close to 500,000 deaths in women. We know how to get it done. We will get it done. But the way it happens is literally one community at a time. And as I said before, you do not do this work alone. We need large employers. We need healthcare insurers. We need hospitals. We need healthcare providers. And we've organized ourselves in the ACS to work with every one of those sectors to bring them together, and we will do this work. Relay for Life, I truly believe, can be the catalyst to reducing the cancer burden in your community, not just celebrating what we've done in the past, but creating a world with less cancer in the future. Because, ladies and gentlemen, there is only one American Cancer Society. There is only one organization comprehensively committed to fighting and making progress in every stage of the cancer battle, from prevention to early detection to diagnosis to treatment access to better cures to palliative care to cure to end of life. There is only one organization that does that work. There's a phrase that we all say: we have the goal of ending cancer as a major public health problem in this country. And I challenge you today to ask yourself, for you, is that a slogan? That's something to raise money with? Or is that something that you really believe that we can do? Really believe that we can end cancer as a major public health problem? Well, ladies and gentlemen, I'm Dr. Richard Wender. I'm our Chief Cancer Control Officer, and with my 6,000 staff, 2.5 million volunteers, and millions of other people dedicated to the cancer fight, the researchers, the healthcare providers, the large employers, the people who create healthier places to live. For me and for all of us, it is not a slogan. It is our work. It's what we dedicate ourselves to every day. We do believe, and we will make the pledge to end cancer as a major public health problem in this nation. We will get it done. I feel confident of it. And I believe that the state of Florida can lead the way. I have confidence that it can be done starting right here. You know, for us, every day we remember one thing really spurs us on in our work. We relay, but we always remember, what is it we're relaying for? And what really helps us paint that world purple. And I say the world because we are now a global organization and we are making a difference around the world. We relay for life. Thank you, Florida. Keep up the good work. Let's go kick some cancer butt. Let's get it done.